in November 2017, I was getting ready to go to work. I'm a theatre nurse, and I was just having my morning coffee, standing at the bench, and all of a sudden just got this pain in my leg. It felt like I'd been shot. Honestly, it was excruciating. I've never felt anything like it. Then I lost the feeling in my leg and I thought I was having a stroke. And got an ambulance, got to hospital. They said, at that stage I could limp, and they said, oh, maybe it's your back, maybe you've got a bulging disc. So they sent me for a CT scan. I didn't see the referral, so I had a plain x-ray first. Obviously they saw something, but I didn't know that. They didn't tell me. Had the CT scan and I went to work the next day. I was in a lot of pain, but I was doing an extra shift and they were short-staffed, and so I went to work. I didn't know it was anything serious. I got a call from the hospital to say that I had to have a bone scan, which worried me because it's not a routine test. And then a call from my GP asking me to come in, and he told me that they thought I had myeloma, which I had never heard of, and I had no idea what it was. The pain in my leg was a big lesion and my femur was going to snap. Anyway, initially the haematology team thought I was too well to have myeloma because all my other bloods were really good. They thought it could have been a secondary cancer from breast or ovary or bowel. So I had lots of tests, eventually having the light chain blood tests and a bone marrow biopsy, which confirmed that I had myeloma. So we actually saved up. We were leaving in 2 weeks. We'd saved really hard to go to Europe for Christmas. So yeah, the only white Christmas was the white hospital gown. So yeah, that's how it started. After I was diagnosed, it was, I think, pretty standard sort of myeloma treatment. 4 rounds of 4 weeks induction treatment, and then you donate your stem cells. It's a bit like having dialysis through the neck. They treat them and then they admit you and give you a massive dose of chemo to kill off your bone marrow, and then you have your stem cells back. So that was my first stem cell transplant. Actually, it wasn't too bad. And I went into remission and eventually went back to work in October 2018. Initially, I was put onto thalidomide for maintenance, and it just, after about a month, I was just so sick. It was like I had no quality of life, and at that stage, there wasn't really anything else that they sort of offered. So one of the things myeloma does is affect your bones. And within the space of a month, I broke 2 ribs, my jaw fractured, and my collarbone fractured for the second time in 12 months. So I was really in a mess. I was offered a trial with Professor Hunkwash at St Vincent's. I had a Zoom conference with her and then met with her. I was admitted at St Vincent's, undergoing some tests leading up to starting the trial, and yeah, I've started a clinical trial with Hung, and I'm in remission. So initially it was pretty brutal. I was obviously quite unwell. I spent 19 days in St Vincent's when I started the trial, and now every Thursday I go to the cancer centre and have the trial drug every week, and then once a month there's some other drugs added in. But honestly, it's saved my life. She is just the most amazing person, and I'm so grateful to have qualified for the trial and so grateful to have met her. Look, my life isn't what it was, but I have life. So, and for the most part, I don't think anyone, if they didn't know, you wouldn't know that I was sick. Yeah, look, this is one of the new bispecific antibodies, which is one of the new big things in myeloma. So I'm really lucky to be on one of the latest treatments in the world. How do you say thank you? Thank you doesn't seem enough. Thank you doesn't seem enough to the team at St Vincent's and Hung Quash. She is just incredible. And she's just an angel.